Hi, hello, and welcome back to you all on my new series on diabetes education. I am Dr. Vinayak Hiramat, Chief Medical Officer, Consultant at Department of Diabetes Endocrinology, KMK Hospital, Cochin, Kerala. My friends, today we'll be discussing about the symptoms of diabetes, how do we diagnose diabetes, and what are the complications of diabetes. Right? We'll go step by step. I think already I have discussed the type of diabetes in the last episode. So the symptoms of diabetes is more or less similar with all the three types of diabetes, which is because ultimately it's either due to lack of insulin or resistance of insulin. We have high blood sugars, and which leads to the following symptoms. The three classical symptoms of diabetes are polyuria, that is frequent passing of urine. Second, polydipsia, being very thirsty. Polyphagia, feeling very hungry in spite of eating frequently. Other symptoms such as feeling tired, losing weight even without trying, sores that heal slowly, dry itchy skin, feeling of pins and needles in your feet, blurry vision, abdominal pains, vomiting, bloating, frequent urinary infections, genital infections, abscesses, or sometimes no symptoms at all. We do find such cases on a random examination that they do have diabetes, right? So how do we diagnose diabetes? Routinely, for screening purpose, we use random checking with glucometer, which is widely available, and if the reading is more than 140 gram per deciliter, that indicates you have diabetes or risk of developing diabetes. The main confirmatory tests include fasting blood sugar, that is 110 to 125. It is pre-diabetes. More than 125, it is diabetes. And 2 hours after the meal, blood sugar 140 to 160, pre-diabetes, and more than 160 is diabetes. The most important test, that is HbA1c, 5.7 to 6.4% is pre-diabetes, and more than 6.5% is diabetes. As I told, this is the important for diagnosis of diabetes and also the pre-diabetes. So I am planning to have a separate video on HbA1c. What does it mean and how often you should get it tested, which I will make a separate video very soon. So these tests give the confirmatory of diagnosis of diabetes, especially type 2 diabetes. For type 1 diabetes, apart from this test, we do antibody testing, and for gestational diabetes, we do glucose tolerance test, that is, we call it as GTT. Next, how do we treat diabetes? The treatment of type 1 diabetes includes insulin therapy, exercise, and meal planning. The main thing is to educate on carbohydrate counting, because they have to take insulin 3 to 4 times a day. So they should calculate the dose depending on the carbohydrate meals. I feel very emotional when I encounter this type 1 in my hospital, because they are such a small kids who are allowed to have chocolates, play in the ground. I have to say no to the chocolates, ask them to prick daily, check the sugars, take insulin, which is really most challenging part. To teach them, especially how to calculate the carbohydrate in a meal, how to take insulin, that is really pain. But again, the science has grown. We have a suitable upcoming technologies to overcome all these hurdles. And speaking of type 2 diabetes, the treatment focuses mainly, as I told, this is a lifestyle disorder. So it's the person's ability to more effectively use the insulin. So we first start with the diet and exercise for type 2 diabetes. And also we give the weight loss tips, which will help them to decrease the insulin resistance, and in turn lowers the blood sugar levels. If the blood sugar levels are still higher, there are many medications which can help either stimulate more insulin production in the pancreas or help the body better use the insulin it makes. So if they fail to control, then insulin injections may be needed. If the medication, diet, exercise, everything fails, the sugars are still not at control, even in type 2 diabetes, we give insulin. Remember, it's a lifestyle disease. The next is gestational diabetes. This includes meal plan and insulin. Only insulin is the treatment for the gestational diabetes. So if we are not treating this diabetes very well, what are the complications of diabetes they may end up? New advances in research and treatment methods are helping the people of diabetes live full, active and healthy lives. However, it is important to remember that diabetes is a serious chronic condition that potentially leads to short-term and long-term complications. So those who take insulin must constantly be concerned about their blood sugars because they can cause reactions, high blood sugars, low blood sugars. So that needs to be met. And then the meal and exercise program. People with undiagnosed or untreated or long-term diabetes are at risk of developing the micro or macrovascular complication, that is vessel damages. These potential complications which can affect the eyes, we call it as diabetic retinopathy, kidneys, diabetic nephropathy, limbs, diabetic foot or diabetic neuropathy, even the heart, myocardial infarctions, strokes increases the risk, stomach problems or may occur after many years of diabetes. So early detection, improved medication, regular checkups and usage of new technologies may help prevent or minimize the diabetes related complications. I got many questions in my inbox regarding that. Can diabetes be prevented or reversed? First of all, yes, if you are talking about type 2 diabetes, it can be prevented. If you are high at a risk and start practicing the healthy lifestyle and exercise, you may prevent the type 2 diabetes, but type 1 diabetes cannot be prevented. Many even ask, can type 2 diabetes be reversed? Yes, a lot of companies have come up with saying that type 2 diabetes reversal programs. They have told that type 2 diabetes can be reversed. First thing, we medically don't call it as reversal, we call it as remission. That means you are still prone back to develop diabetes if you stop practicing the lifestyle diet exercise. Let's not forget that type 2 diabetes is a lifestyle disorder and the day you lose the balance, you are prone back to it. But never hesitate to start the medications as early as possible when you are diagnosed with type 2 diabetes, because the earlier the detection and harder we hit with the diet, medication, exercise, you can prevent the ongoing damages. And yes, we can stop the medicines in type 2 diabetes if you attain the remission phase, and advise to follow only the diet. So stay tuned guys, for the next video we'll give you tips on how to manage diabetes while having diabetes and how you can prevent the complication of diabetes and stay healthy with the journey of diabetes. Meanwhile, if you guys have any questions about the diabetes, do drop me in my inbox or the comment section. I will try to answer them, all of them. So until then, stay tuned. So let's not forget that lack of awareness and education is the reason today we have the highest number of diabetes cases in the world. I hope to do my part of responsibility to try to bring down these numbers and also to be part of your diabetes journey to make it smooth and comfortable. So thank you. That's it for the day. Take care.